So my name is Dr. Ashley Bose. I'm a family medicine physician as well as medical director and co-owner of Ashley Pediatrics and Industrial Healthworks Clinics. Here as a lecturer, graciously invited by South Texas Health Systems to talk to children, 3rd, 4th, and 5th graders about Diabetes 101.
How many classes have you had to take today?
So only 2, but it honestly has flown by. It's been a joy, so I could do a couple more if they would like.
They always come up with some great questions or great observations about what's happening in their family.
Certainly. I had a lot of children talk about aunts, uncles, mom, dad, that they've stopped eating sugary things, or they've just been diagnosed with diabetes. So the fact that they're willing to share, and it helps with the learning, it helps keep them engaged, and it makes it more relevant to them. It's not just some strange illness that you're talking about. It's affecting them, their day-to-day life, their parents, sibling, etc.
So can I ask, how bad is the diabetes issue in the Rio Grande Valley as compared to, say, to other parts of the state?
So, and I wish I had statistics, but just based on what we see in clinic, I mean, diabetes used to be an illness of adults in their 40s, 50s, etc. And just as the obesity issue has kind of increased, we're seeing more and more kids in clinic that are being diagnosed, unfortunately, at a much earlier age than they should ever have to be. And so that's why prevention is really the key.
At Tuesday's forum, one of the health experts at today's forum, because South Texas Health System had 2 of these, one for adults, one for children today, but one of the experts here today was telling me that this area is known, statistically, is the fattest part of America. Is that, you've heard that?
I've definitely heard that. I know there were some controversial articles and things from many years ago that I had read, but I don't doubt it. There's a lot of things contribute: socioeconomic status, the diet, culture, health literacy. So many different things play into it. So it's not a single cause for it, but unfortunately that is a reputation that we do have here in the Valley.
So the message you wanted to get out to these students, these young kids today, was prevention. What were you advising them to go home and tell their parents about?
A lot of the kids actually said it themselves. They talked about physical activity. They talked about, eating fruits and vegetables. A lot of them said it themselves, and I invited them to come present with me because they were basically giving my presentation. But I mean, those are the key things. We talked about no smoking, limiting alcohol intake, just a lot of the things that we all know to do, but I think just reinforcing it and reiterating it. And these children are sharp. I mean, they know it already, and they're doing a lot of these things already.
It sounds from there that, I know that's not scientific data, but if the students know the issue and they know what they should be eating, it's not necessarily a question of education.
That is true. Sometimes they know what they should be doing, but a lot of times, one of the things we come across is, let's say, the sugary drinks and the sweets. If it's not purchased and if it's not at home, then you don't have access to it, right? So sometimes it's parents are buying these things, and so they might know, but it's hard. I mean, you hit summer vacation, you're not as active, and these things kind of catch up to you.
I can see the president of STC, Dr. Solis, behind us. It sounds as though he's going to speak. So I'll wrap this up. No.
Sure.
Anything else you want to say, Ashley?
No, just feel very fortunate to be here. We've been serving the community for 20 years now. It's our 20th year with Ashley Pediatrics, and so now going into the classroom and trying to educate to help prevent this. I mean, it just kind of all comes full circle. So. But
it's sort of sad that you've been growing so fast. You can think of it that way.
That's true. I mean, we see other things other than diabetes, but and we're here for children regardless of what their needs are. But I think to be able to teach them before they even come to us, it helps a lot. So my goal is for them to go home today and say, Mom, I learned about insulin. I learned there are 2 types of diabetes. I want them to go home and talk to them about what they learned today.
Well, Dr. Bose, thank you so much for today's interview.
Thank you so much.